Start with the Tai Chi point, K3 point, one shown. So where exactly there is a K3 point, try to find out. This is the tip of the when I use respirate, no, it will not work sometimes. K3 point and then the Achilles tendon. Yeah. So now the point is located midway between these two. The point is located. So now try to palpate. And then what artery is existing? Posterior tibial artery is existing here. This is the posterior tibial artery. You palpate that. So anterior to that artery, the point is located. That to be known as a K3 point. You just apply. Yes, don't shake in that way. You may get some kind of the pain. But now K3 point is great point to treat for the numerous condition. Now K3 point.
Sir, I have burning sensation.
Yes.
Yeah.
On the Kunlun UB60. Right, once I applied the needle towards the UB60, so therefore you just one needle connecting to the 2 points, 1.5 tune needle, you just use it, apply the K3, the needle can reflect on the back side of the UB60 region, this region, UB60 region, right. So therefore through to through needling, we can connect like this. Right, K3 is this side, UB60. One needle reached to the UB60 as well. In that way, we can apply. She felt as a slightly variation on the posterior side. Hopefully, kidney 3. So once you apply, what happened? Sometimes the needle get slanting or the shake. Once it gets shake, then you recognize you applied on the posterior tibial artery. You applied the needle, then withdraw the needle, and beside that you just apply. That would be really good. Hopefully, we understand about the K3. But K3, I can say there are the two locations K3. Even you can apply the K3 here also one point, but this point also K3. So as per the modern acupuncture, this point to be known as a K3 point. But sir, don't make it as a confusion for us. But however, I'm giving you extra information. But hopefully this is the K3. Now K4 point and K5 point. So 3 points together, I'll tell you the indications. You can recognize. Now there is a K5 point. I try to find out where exactly K5 point. What is this bone name? Calcaneal bone, right, superior to the tuberosity of the calcaneal bone. In the depression, this point to be known as a kidney 5 point. Then further midway between these two, and then very closer, and then inside of the Achilles tendon, that point to be known as a kidney 4 point. That is a Ta Chung. So hopefully this is the taxi. You remember TAXI, taxi is K3 point. Don't pronounce taxi, but Taisi is the pronunciation. K3 point, and then K4 point is located exactly. You can recognize half tune distal and then posterior to the kidney 3 point to be known as a K4 point. Right, now the K5 point is located 1 tune distal to the 1 tune distal to the K5 point to be known as a K6 point. K5 point, apply here quickly. So K5 point is, yes. So now K5 point. Now K3, K4, K5, K4 is the luo connecting point, which is controlling. It ascends to the upward direction. This interiorly connected to the urinary bladder. From the urinary bladder, it ascends to the upward direction, communicating to the K10. From the K10, it goes to the below the breast. From the below the breast, it passes to the posterior side of the vertebra. That's the lumbar vertebra. Lumbar 1, 2, 3, 4, 5. Lumbar 1 to lumbar 5 vertebrae are connecting by using the K4 point. But the K5 point is the cleft point or the emergency point and accumulation point is there, that one shown distal to the kidney 3 point is the K4 point is located, but this point is emergency condition. That means the any blood related disorders can be treatable by activating, or the renal stones or the kidney stones are continuously getting the pain on my kidneys, that time need to control the kidney pain. Obviously you can use the point that is the K5 point as well. So now let me know K3, Tai Chi, Tai Chung and then Shui Chuan. These are the 3 points are great points to treat for what conditions? To strengthen the kidney system, and also the spleen and then kidney activation point. K3 is the grandmother point, as I told you, is the grandson point. Now this is the grandmother point to strengthen the kidney system. By the way, this is the one point which will be useful to treat for all the renal related disorders. Any kidney problem, you remember K3 point to be activated, along with that as a supplementary point to be activated. Remember the women, or the especially for the girls uses the ornaments, that is the anklets they uses. Remember, these are the hormonal imbalances to be activated. Whenever there is the female hormones like estrogen, progesterone and also mild testosterone level, all are required to the female. Luteinizing hormone and also follicular stimulating hormone, further is the anti-Mullerian hormone. All this very much the follicular study need to be activated. Ovaries needs to produce a lot of ovum. In that condition, obviously these points are required. This is also to be known as the infertility protocol as well, to treat for the this I applied on the left side. Treating for the left side of the kidney is the left side of the kidney to be proper kidney, but whenever there is infertility and other essence related problem need to be activated, then it's advisable to use of the Mingmen, that is the gate of the life, by using the which side of the kidney? Right side of the kidney is to be activated. Same points you just apply on the right side would be better to treat for the female genital related disorders, or the gonads related disorders for the male can be treatable by activating on the right side. By the way, this is the hot flushes. Lot of heat get excessiveness on my scalp region. Further, my acidity and gastric region is more. Then the abdominal bloating is there. My spleen malfunction is there, or the overfunctioning of the spleen. That time need to drain out. That time the heat will come down to the lower portion. Whatever heat on the sea of the marrow on the brain, and also there is abdominal heat can be minimized. Then the coldness will become the balancing by using this specific K3 point. K4 point for the back pain, obviously we can use both the points. This for the renal stones and also for the any blood related disorders we can activate. Now let me see the K7 point, no K6 point. So K6 is the most imperative again. Then this is the tip of the medial malleolus. Then you try to find out there is a depression, there is a tendon, and also there is a depression you can find here, but authors will write as a 0.5 chone. Some authors believes, and then they write 1 chone distal to the innermost ankle. Right, this is the innermost ankle, this is the outermost ankle. Innermost ankle to be known as a medial malleolus, where Jayashri wanted to apply the needle herself. You just apply. So K6 point is the good point to treat for the. So what conditions? Insect bite. Anything insect bite, or maybe mosquito bite or something like that, any infection may not get. So that time you wanted to use, you can apply this point. By the way, this is the soothing point for the throat as well. Remember, anything is the throat related disorders you need to activate. Use the 2 points. 1 point to be known as a Chauhai, that is the K6 point. The second point to be known as a Rangu is the topmost distal point. Along with that, you wanted to use some of the local points as a particularly related to pertaining organ. Then use the Li Chu, Lu7, and then Shaoshang, that is Lu11. Both the points are good point to treat for the throat related disorders. By the way, the K6 point is the good point to treat for to bring down the calmness of the brain, and also to induce the natural sleep as well. By the way, yes. And along with it, what happen when there is the convulsions happen for the children, but nighttime convulsions and also daytime convulsions. If the daytime convulsions, which point need to be activated? Shenmai, that is the UB62 point I told you, that is for the daytime fits, and then nighttime fits happen. That time this the kidney 6 point. Kidney 6 is belongs to the K6 is the belongs to the Zhang viscera, that is the in viscera. In viscera is connected to the in viscera is connected to the nighttime sleep. Remember, in is the storage organ, is the nighttime. We can use the nighttime epilepsy can be treatable by activating the K6 point, and the daytime epilepsy can be treatable by activating the UB62 point, that is on the posterior side of the same point. This is the medial malleolus tip, lower portion. This is the lateral malleolus, the lower portion. We just activate, that would be really better. What happened nearly? The C of the marrow also to be activated by using this point, that is the K6 point is great point. By the way, to induce the natural sleep as well, and also it is the topmost distal point for the hemorrhoids. Better, Jacqueline. So piles related problem, or maybe something related to the internal piles, not the fissure, but piles related problem can be treatable by activating the K6 point as well. Hopefully you understand. But now anything as a summary wise, throat related problem, epilepsy related condition, piles related condition treatable by using the K6 point. And by the way, the ankle having the problem, then also you can apply some local point as well. Now let me proceed for the K7 is the topmost imperative point, where exactly this point is located. That's called as a folio. I think somebody will just apply folio. That is the 3 chone proximal to the 2 chone proximal to the, yes, where exactly you just K3 you can see come vertically above this, and then 2 chone above, and this is the Achilles tendon, anterior to the Achilles tendon. These muscles to be known as a soleus muscles, and also this is the posterior tibial artery to be activated. But now you can apply the tibial now. So where you will get the current, that means is some kind of the vibration or current you will going to get, or vibration you will get on the till the lower portion, that indicating there is a folio, is meaning is returning the current. That means returning the current. That means you just apply that needle, then the patient feels some kind of the vibration or electricity passes, that indicating that the tibial nerve to be activated. When the tibial nerve get activated, obviously whatever the nerves which is connecting over there is the digital nerve or the plantar nerves to be activated by activating this point. So therefore you just apply the perpendicular direction, and then patient feel the vibration till the toes. But once we'll get the detchy sensation, then you recognize that point you applied precisely. If the patient don't feel that sensation, then the patient may not be totally all right. So that's the reason. Now you shouldn't change. Once you change, then again we'll get some kind of the congestion in between the muscles that causing the problem. Hopefully you understand. K7 is the great point, what I told you, related to the nearly 3 hours speech on the kidney meridian. By using the one single point you wanted to treat and regulate, then you remember the point to be known as a folio. K7 point is the one single point will be strengthened to the kidney system. No doubt you can use a supplementary point as well, but K7 is the mother point for the how the father day today. Today is the father point of the kidney meridian. We activated that to be known as a folio. K7 point, where 2 chone proximal to the kidney, 3 point the returning of the current to be taken place. However, there is the anything is the lower problem, kidney problem, where exactly there is the creatinine level excessiveness when it goes to the 1.5 or the 2 or 3, 4, 5, 6, 7. In that condition where the EGFR glomerular filtration rate is very poor, in that condition you need to be activated. Remember, these are the protocols really works wonderful if you can activate regularly by activating the stimulation. Mild stimulation to be given by these points, but however she's getting very shocked now. But in the one frequency I just give not two, but you just give us a small vibration, but she'll get the more vibration, so indicating that too in one frequency. So if we increase 2-3 frequency and she cannot hold the leg, so however we can give mild stimulation to all these points, that would be really better, right? So K7, K3 points is the mother and grandmother point to treat for all the renal system related disorders. Remember, the renal parenchyma or the medulla or the nephrons need to be activated, mild to moderate level having the problem. Then we can maintain this. Is not totally recover. If the Almighty wills, the patient will be totally all right. He can be come out from the kidney related problem. But however, these points will maintain by using the acupuncture points. We can use this point to treat for all the renal related disorders. By the way, we have completed some of the command points except one point. Now let me see, there is another point to be known as a chioxin. Chioxin, the point is half tune anterior to the K7 point. This point to be known as a K8 point.
So K7 is equal to LU5.
LU5, exactly. K7 is related to the lungs and then kidney communicating point. Then the K7 is equivalent to the LU5. Remember, whenever there is the kidney is need to store or need to capture the energy of the lung system, that time you can apply the cough and then congestion and then something shortness of breath, breathlessness or asthma related condition can be treatable by activating the point to be known as a K7. Or you wanted to add up 2 points, one point to be known as a Chiza, LU5, the second point to be known as a K7 point. Together you wanted to treat, but obviously you can use both the points at the same time as well. Now K7, then a K8 point to be known as a chioxin, that is the inhale vessel. So that is this also C cleft point, the K6 also C cleft point, and K9 also C cleft point as well. Now let me see.
Just 3 C cleft.
Yes, the another meridian, the confluential meridian, C cleft points. But now the K8 point is the chioxin. Remember this point also, how there is a spleen 6, spleen, liver, kidney. Where is a spleen 6 point? Yes, 3 tune proximal to the medial malleolus. This is a kidney. Spleen 6 point. Just 1 tune below the spleen 6 point, K8 point is located. This also encircling to the 3 internal orbs, that to be known as a spleen, liver, kidney. 3 organs to be monitored and regulated by this point. But however, anything blood related disorders, menstruation related problem, bleeding not happen, even that condition also we can use the K8 point is good point to treat and then to stop the bleeding and to regulate the bleeding. Both can be possible to choose spleen 6, and the also K8 point is good point to treat for the blood related disorders to stop the bleeding as well. So K8 point is a good point, and even few years ago I have studied that upper limbs are controlled by the one point and then the lower limbs are controlled by the another point. Upper limbs are using NIC1, that is the P6 point, it regulates the upper limbs, and then the lower limbs are regulated by the K8 point. K8 point, such a powerful point. Yes, ST44 is the secret point of the stomach.
No, the 44 for pain, lower limbs pain.
Pain, yeah, ST44 is good point, analgesic point.
This is more effective than that.
Yes, this is the controlling to all the 3 organs. Number 1 is spleen, liver, kidney, because it controls below the navel. Above the navel controls the P6. So likewise, the author has written, you wanted to recognize the acupuncture point. 2 points you can recognize, one to be known as a P6 and then second to be known as a K8 point. Both the points you just apply to overall treatment for the health. Whatever XYZ problem, you remember to balance and making the equilibrium. We can use 2 such a powerful points are existing. But however, no doubt I'll try to teach you all the points. But sir, don't make up the mess it up to us to understand. इतना नुस्खा दे दो जो 2-4 पॉइंट सीख ले, हम लोग उसी में प्रैक्टिस करें. ऐसा नहीं है, but still you try to find out 30 to 50 points, but having the great amazing results. इतना भी आप दिमाग में रखते हैं तो hopefully we understand. Then the K9 point to be known as a chopin. Chopin is again 3 tune proximal to the K7 point. Then further you try to recognize this point to be known as a K9 point is the great point. This also C cleft point of the, so inhale regulating vessel. Very good. rather than applying somebody else. Why somebody? I will give my leg, and she's thinking I apply myself. So hopefully K8 point is the good point. K9 point is the chupin, and Prabha Borvankar has written in his book, maybe this the genetic disorders cannot be transferred to the baby. So that's the reason at the age of the second trimester onwards of the pregnancy, that time you just activate this point, give the pressure, not the needle. But second trimester, no needle, but better you give only the pressure to the patient.
No
That
needle
means
at any point or only this point?
only this point is not advisable, but some of the points you need to refrain. But generally you just give diabetes and hypertension, or the thyroid, or maybe some other cancer, or any related chronic related problem shouldn't transfer to the baby. On that particular situation, you just give the pressure to this point is good. So now K8 point, K9 point is क्या या whoever don't feel अभी लम बैठे, किसको खड़ने में मुश्किल हो रहा है तो प्लीज बैठ जाइए. So K9 point, hopefully you understand this is a really good point to treat for the genetic related disorders may not pass on to the children. Now the another last point to be known as a command point, last point is K10. Now let me see where this point is exactly located. Now we recognize the point. You try to find out the location, but now I'll try to see this is the hamstring muscles. There are the three group muscles called as a hamstring muscles. One is the biceps femoris muscles, and also semimembranosus and semitendinosus muscle. But there are the three muscles called as a hamstring muscles. But now try to find out there are the two muscles will become the two tendon. One is the semimembranosus muscle, and then the second one is semitendinosus muscle will become the two tendon. So those tendon name is here. We try to find out, touch and then find out. You touch and then feel, then you can find the tendons, two tendons. So for the first tendon what I am touching, that is a semitendinosus tendon. Inside tendon to be known as a semimembranosus tendon. How to recognize and keep it in the mind? Sir, this is the semi is my name, hope you recognize. And then membranosus, membrane, M starts, M indicating middle. Right, tendon, semimembranosus is the middle muscles, and semitendinosus is the medial side of the tendon. Right, first one is biceps femoris is the largest muscle, biceps femoris. Turn on this side. So biceps, this is the hamstring muscles, and these muscles are the biceps femoris muscles, biggest muscles. And then from here, the middle muscles here, this is the semimembranosus muscle. These muscles are the semitendinosus muscle. Right, this side is semitendinosus muscle. Now this, if you don't know that, need not to remember, you don't remember, but you try to find out two tendons. Midway between the two tendons this point is located. Now I'll try to find out the location. You have to give the deep pressure. So once you touch and then feel, because she is very thin lady, but we cannot find out her. So however we try to find out is the deep pressure. Now I found it that as the two tendon, then you just inside between the two tendons, right? It goes to the deeper level. So now this to be known as a K10 point ingu, but now need to be activated this towards the tonification. That means you are increasing the energy of the kidney, but same time you wanted to use the same point, need to be decrease the energy. You just apply the needle in the opposite direction. That means this you are sedating the energy of the kidney. But when you wanted to do as a tonification, sedation or neutral, you don't know. You just apply the 3 points together. But this is as a my way of yes. Then you can recognize however this. But 3 points at a time you are activating to become the tonification or to sedation or to get the neutralization of the kidney energy. 3 points together you can activate the Ingu point. Ingu, Rangu, Hengu, Tahe, Chiksi, Semen, right? All are Chinese names, but you can use the Ingu point. K10 point is the good point to increase the energy. Now, sir, we don't know whatever I wanted to do, strengthen my kidney system. Then you can recognize that एक ही point बोलो जिससे वो किडनी का एनर्जी बढ़ जावे. तो फिर ऐसे सिचुएशन में एक सिंगल पॉइंट आपको लगाना है, तो दैट पॉइंट टू बी नोन एज ए केटन. सर कई को सर इतना बोल डाले रहे तो बस ना, कई को है सब बकवास है. बट हाउ आर सच ए ब्यूटीफुल पॉइंट. लेकिन पूरी फिलॉसफी थियरी आपके मन में रहना है, इजंट इट? सो इसीलिए मैं बकता हूं, तो फिर आपको सुनना भी है. ठीक है. नाउ होप यू रिकॉग्नाइज केटन. Amazing point to treat for the multiple related bone related conditions, but at the same time is the related to the without disturbing to any particular organ. So we are treating this. Now K7 disturb to the lungs, K3 disturb to the spleen, K2 disturb to the heart and brain, K1 disturb to the liver as well. That means it's regulating both. So now the K10 is, no, I don't want to disturb to anyone, but I wanted to activate myself to the kidneys. So therefore you are activating to the K10 point. If the kidney energy is weak, the hair fall is there, or the medial side of the knee pain. Remember, the beauty of this point is what happens is the hamstring muscle. Hamstring muscle's function is hip extension. Hip extension. You lift your, hip extension, you backside. No, not front, backside. Yes, hip extension. That means, hold here. Extend this leg. This called as a hip extension. So hip extension and also knee flexion. Flex your knees. This is as a knee flexion. So this also knee flexion is not happening. In that situation, hamstring muscle having the ability to knee flex and then open. So that time when the knee flexion is not happening to the patient, that time which muscle we need to activate? Hamstring muscle need to activate. But the hamstring muscle will become the tendon. That is the K10 point. K10 point is good point where the knee flexion to be taken place precisely by activating this point. Therefore, you just apply this point, and another some of the motor points of the hamstring muscles also need to be activated to flex the knees. So hopefully we understand this is the K10 point is the till now the command points got completed.